Yeah, thank you, Namrata. I thank AOS and also the Alcon from bringing this technology and also for giving me this opportunity to share my experience with the Ingenuity or the 3D image guided surgery. Next slide, please. I don't have any financial interest. Next slide, please. So before going to the actual topic, if you see the evolution of the science, it has evolved from the earlier civilization to modern day civilization. It passed through some industrial revolution, then agricultural revolution, and then the IT revolution. Now, next slide, please. Now we are in the modern revolution. So if you divide the entire revolutions into first generation, that is the railroad, and then the electricity steam engine, then the second generation, then the third generation. Now we are in the fourth generation of the evolution revolution. So that is now going to hit it with the artificial intelligence, the robotics, and whatnot. So femtosecond, we are in that mode. Like femtosecond laser is one of the starting of that, and then we this 3D Ingenuity is another added feature in that. Next slide, please. So coming to before going to the actual 3D, how it is different from the our routine surgery. If you classify the overall surgery type of surgeries, we started with the naked eye surgery, then surgery with a loop, and then the microsurgery if you use the microscope, and endoscopic surgery if you use the endoscope. And then if you see the image and then do the surgery, that is called the image guided surgery. And our 3D Ingenuity comes under the image guided surgery because we are not directly visualizing it. And if that is done by a robot, then it's called the robotic surgery. Next slide, please. So we are in the 3D image guided and the robotic. Robotic can be with the Lensex. Before going to the how it is different from our microsurgery, we should know little bit basics about the human coordination. It's called the motor response due to sensory input to the human body, because the movement of the our parts in response to the sensory inputs. So it needs to be coordinated. That is called the hand. Best is the sensory to sensory coordination or the sensory to motor coordination. Coming to the sensory, how heart rate or respiratory rate varies with the oxygen demand. That is the sensory to sensory coordination. And then sensory to motor, so when the high hand coordination and the gait are the best examples of the sensory to motor coordination. And our ophthalmic surgery comes under the hand-eye coordination. Next slide, please. So in that hand-eye coordination, there are some hidden things. The movement of hand due to visual input. So we will be seeing the cataract, and then we will decide to touch it. Then our hand should move. So this visual input, brain processes it, and then the output is the motor command to the hand, and hand moves. So further, eye fixates on the target before the hands are used to engage in a movement. So the eyes provide a spatial information to the hands. This difference is in milliseconds. So this happens in milliseconds. Generally, it will be less than the 25 to 30 milliseconds. So any instrument which takes the image from the eye and then to the hand, so it should be within that millisecond. And this moment, once in an experienced surgeons, the moment you see, our hand will move automatically. So that is called the proprioception. Next. So automatically when we are using the microsurgery, our hand moves within no time. So there is no question of any lag in the movement of the hand. And in an experienced surgeons, the hand moves automatically. That is, the proprioception is very active. In the microscope, there is a direct visual response and no intermediary. So we'll see through the eye, and then with the action of the movement of the signal response from the brain, the hand moves. Whereas in indirect visualization, the camera captures and then sends that signal to the monitor through two-dimensional vision. There may be some time lag depending upon the gadget. Though here the challenge is it should process it as fast as your brain and then send it to the visual input. The hand movement depends upon the completion of the saccades, short and long in Aftal. It is in milliseconds. This varies between 100 to 200 milliseconds in a normal response, and any delay beyond this effect, the high hand coordination will be affected. Suppose if the image processes is coming late, next slide, please. Then our hand moves faster before the image moves. The coming to the three-dimensional imaging, and then once the in the 3D imaging, a series of anatomical data is gathered by the system and the technology and processed by the computer and later showed on a 2D monitor to present the illusion of the deepness. The 3D imaging is widely used in diagnostic like software reconstruction, and 3D imaging is the treatment modality is the challenging in live processes, and the resolution main advantage is very high. You can see even the blood flowing in the conjunctival vessels, and the stereopsis there is an extended depth, so there will be an extended depth of the anterior chamber where the play will can be increased. Next slide. This is how the Ingenuity works. So it consists of the 3D camera which is attached to any regular microscope, and then that captures the image and then send it to the processor, and the processor will then in turn will be displayed in the monitor in a 3D, and then we have to use the Polaroid glasses and then to get the effect of the three-dimensional image. Next slide. So this Ingenuity is the imaging tool. So Alcon has introduced in way back in 2017, already 3 years. But initially they have introduced it for the retina, mainly to tackle this lag time. It used to be more lag time. So that's where the retina, the instrument's movement is not as fast as in the anterior segment. So they first introduced in the posterior segment, but as the newer generations and advancements in the software, they have reduced that lag time, and now it's almost within the range of the human processing system. So now that lag time issue is not at all there. So when they could overcome that lag time, so it now can be safely used for the anterior segment and the cataract. Now next slide. So this can be used in the pterygium surgery. I will play the video at the end. Next slide. In all kinds of the surgeries, even you can use it for the trabeculectomy, where everything can be visualized at a higher depth. Next slide, please. Can be used in the 3D guided imaging phaco surgery. All anterior surgery segment surgeries can be used. Next slide, please. So it gives a good resolution, it gives an extended depth, more flexibility in the instrument movement, and it is very safe. And it can be used for most of the anterior segment surgeons. And it's hardly any learning curve, and there is a less strain on the surgeon's neck. And the good part is your entire team in the surgery will start involving in the surgery in each and every step, and they will enjoy the entire process. And it is one of the best tool for the teaching. That is the main advantage. The postgraduate teaching, it's an excellent tool of displaying the all the steps of the surgery. Next slide. So this is in nutshell about the 3D Ingenuity. Kamrata, can I share my slide? Just a video I'll play.
So I think that was an excellent presentation on 3D surgeries. What companies also need to do is that we are doing 3D surgeries, but we should also be watching them like this, sitting on our laptops. Then that is the beauty of the whole thing. And I don't know when that device or that thing is going to actually come up. Yes.
Amrita, can you see the slide? One.
I it came for a while and now I can only see my picture. I don't know why. Yes. Now it has
Now,
come. Yes, it has come. You can play now.
yeah, yeah. You can sit relaxedly. So you can see how entire OT team they can wear and then start seeing and each and every step. So neck movement and then the entire surgical process, each and every step, it can be, it's an excellent tool for the postgraduates. And the safety is increased. The other when introduced in 2017, it was an off-label use. Now I think it can be used for all the surgeries. There are other companies like Jais and then the Upper Swami also. They came out with this type of the instruments. Even the posterior capsule, everything we can see very clearly. And then yeah, that's it, Namrata. Thank you, thank you.
Thank you so much, Dr. Gopal Raju,